All right, let's jump right in. Today, we're talking about something that really affects anyone who's ever been a patient, a system called Access, Assessment, and Continuity of Care. Yeah, I know, it's a mouthful, so we'll just call it AAAC. It might sound a bit technical, but trust me, this is the essential framework that's supposed to make your entire hospital journey safe, coordinated, and, well, makes sense.
I mean, have you ever been in a hospital and just felt completely lost? Kind of like you're just a number on a chart? Maybe you were confused about what the next step was, or it felt like the team on one floor had absolutely no idea what the team on another floor was doing. It's a really common feeling, and frankly, it's pretty unsettling.
And that feeling, that's what happens when patients start to fall through the cracks. You see, in a system that's so massive and complex, it's just so easy for critical information to get lost during a transfer, or for you to hit these frustrating, totally unnecessary delays. But there is a system specifically designed to be that safety net. And, yep, you guessed it, that system is AAC.
Okay, so let's mind the gaps. Before we can really get why the solution works, we have to understand the problem it's trying to solve. And it's just like those signs you see in the subway, right? In healthcare, those gaps are the dangerous moments. The times when your care gets fragmented, where coordination breaks down, and crucial information just disappears. And that puts patients in real danger.
This quote just nails it. It says that how you first enter the healthcare system and how you're evaluated right at the very beginning, well, that sets the tone for everything that follows. We all know first impressions matter, but in a hospital, it's not just about setting a tone. It can literally define the success and safety of your entire experience.
So, the big question is, how do we build a bridge over those dangerous gaps? Well, that's exactly where the AAC blueprint comes in. Think of it like the official architectural plan for building a house, but instead of a house, it's for patient-centered care, making sure every part of the structure is sound and connected. At its core, AAC is a standard covering 3 huge phases. First, how you get in the door, that's access. Second, how they figure out what you need, that's assessment. And third, how they manage your care seamlessly over time. That's continuity of care. You know, there's a good reason this is the very first chapter in Patient-Centered Standards.
Okay, let's break that blueprint down. It all kicks off with access, which means you get timely care based on your medical need, not your status. But just getting in the door isn't enough, right? That leads to a proper initial assessment from a qualified professional. That assessment then becomes the foundation for your personalized care plan, where, and this is key, you get to have input. And none of that works without the final piece, continuity of care. This is the glue that ensures, as you move between departments, your plan moves with you through clear communication.
All right, so we have the blueprint. Now let's follow the path of a patient and see how this is all supposed to work in the real world, step by step.
You can really see how one step is meant to lead right to the next. It all starts with something as simple as getting an appointment. Then, there's a triage check to see how urgent your case is. Once you're admitted, a structured assessment helps create your individual care plan. And that plan follows you the entire time, all the way to getting you ready for discharge. See? Each one is a link in a chain, and the whole point of AC is to make sure that chain never, ever breaks.
Of course, having a perfect blueprint on paper is one thing. Making it a reality in a busy hospital, that's a whole other ballgame. This is where we need to get real about the challenges, and more importantly, talk about your rights as a patient within this system.
And listen up, because this part is incredibly important. Under AAC standards, you have rights. You have the right to get care without a crazy, unnecessary delay. You have the right to be fully informed about your condition and the plan to treat it. You absolutely have the right to participate in decisions about your own body, and you have the right to access your own medical records and test results. Just knowing this stuff is a real game changer.
So how do we close that gap between the rights you have and the reality you might face? With practical solutions. For long waiting times, you use smart digital scheduling. For poor communication during handoffs, you implement standardized protocols. Think of it like a pilot's pre-flight checklist. To stop incomplete assessments, you need regular staff training and audits. These aren't just vague ideas. They're the actual tools that make the promise of AAC real.
So as we start to pull this all together, let's bring it back to the fundamental goal here. Because all these rules, all these protocols, they all serve one simple but really powerful purpose.
And that is the promise of AAC. It's not just about bureaucratic red tape. It is a commitment from the healthcare system to you, the patient. A promise that your care will be coordinated, that it will be continuous, and that you will always be at the very center of it all.
Which brings us right back to where we started, with that massive question: how do we make sure no one falls through the cracks? Well, we know that good intentions just aren't enough. It requires a robust, well-implemented system like AAC. And it also requires all of us, the providers and the patients, to understand how important this is and advocate for it. Thanks for joining this explainer.